within those vertebrae, there are little receptors on the bottom of the joint. And this is true for every joint in your body. As any two joints meet, those receptors on those joints tell your brain their position to the bones next to them. So in this particular case, this bone would be saying, I'm a little bit tilted to the right, there's a wider space on this side, and the bone below would be saying, yep, wider space on this side, I'm slightly tilted to the left, and that information is fed through your nervous system to your brain. And that happens in every joint in your body, every second of every day. And what your brain does with all of that information is it forms a picture, an image of where your body is based on all of this information that these joints are telling your brain. So what would happen then if all those joints now are feeding information, but it's wrong? These joints are like this, but yet they're telling my brain they're like this. How well is my brain going to be able to control those joints if it's getting improper information? What do you think? Not going to do a real good job, right? That's what happens when joints are arthritic, joints are immobile, when there's any sort of deterioration within a joint. That feedback mechanism, that communication in those receptors gets lost. So an example that most people can identify with is somebody who's sprained their ankle in the past. Those people tend to sprain their ankle over and over again if they didn't rehab their ankle properly. And the reason for that is when I rolled my ankle and I injured those joints, it damaged those joints' ability to send information to the brain. And my brain now thinks, well, my foot's here, but in reality it's here. And so I catch the corner of my foot and I continue to turn my ankle over and over and I keep spraining that ankle. And they say, oh, I just have weak ankles. No, weak ankles. Your brain has no idea where your foot is. You know, as people age, they lose their balance. True or false? False. As people deteriorate, they lose their balance. There's certainly people that are older that don't have deterioration, that have good balance. But yeah, as we age, we do tend to deteriorate, and that deterioration is what causes loss of balance. We take those joints that are immobile and we, number one, restore movement to them again and get those feedback mechanisms firing information to the brain. We can accelerate that feedback, all that information going to the brain, by causing those joints to be able to send information at an accelerated rate by making things unstable. So that's where the wobble disc comes in. If I have to balance like this on one foot, for me to balance, these joints are going like this and saying, oh, I'm here, now I'm here, now I'm here, now I'm over here, now I'm here. And all of that forced communication through those joints, if it's wrong, I'm going to fall over. But eventually, if I keep feeding that information and falling over, I'm going to say, well, that's not right. I need to fix that. I need to lean more this way. And as I force that communication, my brain gets a better chain of information from those joints and gets a better picture of where my body actually is. The program that we're going to cover, the way that we're going to tackle this, is by creating instability. Now, that's going to be different for everybody. For some people, simply standing on one foot, eyes open, hands out, balancing like this is going to be difficult, and that's okay. Other people are going to be able to stand on one foot, eyes closed, hands in, and they're not going to move a bit. And that's okay too. For those people, we then have to create instability. So if we want to improve that communication, we have to challenge it.